Good afternoon, everyone. This is Sarah Arkadians, your clinical pharmacist. Welcome to another episode of Pharmacy Talk USA. Many of you guys have asked for a diabetes video with the summary of the information. So here it is, a summary of what diabetes is, the statistics, screening tools, prevention, treatment, and medication options available in the market for these patients affected. So basically, diabetes is a disease of lack of insulin. We have type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 being the patients usually do not have insulin at all in their body or very little insulin, plus insulin resistance. Some of these patients with type 1 diabetes are born with type 1 diabetes, and basically, anytime in your lifetime, if your pancreas is affected, you may become a type 1 diabetic. Type 2 diabetes, on the other hand, has more to do with weight gain and developing it later on in life. And Then we have gestational diabetes, which happens sometimes during pregnancy. Normal blood sugar levels ranges between 80 to 130, depending on the physician or the guidelines you refer to. But basically, keeping the blood sugar levels close to 100 or between 80 to 130 is what keeps your A1C under control. What is A1C? A1C is basically average of the blood sugar levels for 3 months. The normal A1C for anyone with a diabetes should be below 5.7. When you fall in the range of 5.7 to 6.4, you fall in the range of pre-diabetes. And then diabetes is A1C above 6.5. Some of these patients start with 6.5, they go up to 7, 8, 9, 10, 11, up to 14, 15 A1C, which translates into very high blood sugar levels. A lot of patients experience high blood sugar levels mostly during the day or afternoon times. That's because as they wake up, their fasting blood glucose, which is the morning blood glucose without eating anything, is usually low. As they get with the day and they eat more food, more snacks, and the blood sugar level starts rising. So this is a A1C levels ranges that you should be watching out when you do your labs. Insulin comes from pancreas, beta cells in the pancreas. And when blood sugar levels go up in the body signals the pancreas to produce more insulin. So if your pancreas cannot produce any insulin, you basically have type 1 diabetes. If your body can produce some insulin and your body is resistant also to insulin as a key to unlock usage of the sugar levels or glucose, then you have type 2 diabetes. So basically, pancreas is the organ that makes the insulin in the body. Prevention of diabetes. There are ways to prevent getting to diabetic A1C levels. This could include diet on regular basis, eating more greens. At least half of your plate should be green vegetables, fruits, less carbohydrates, and of course exercise, especially daily basis. Now, this exercise could be an exercise you it's appropriate for you and could be beneficial for you. It could include swimming. It could include resistance training, walking, gardening, even cycling, using bicycle, a stationary bike at home or outside, running, and going to the gym. And so basically any kind of activity that may make you burn your this extra sugar levels or carbs in your body. Diabetes treatment for those patients that cannot handle their get their A1C under control with just diet, and then these patients start with getting on diabetes medications, which I'll talk about. But before that, but I want to share some of the statistics about diabetes. About 38 million adults have diabetes in the United States. That's 1 in 5 of them that don't even know they have diabetes. Usually, some of these patients end up in the hospital for various different reasons. It could even be accidents. And then when they do blood tests, they figure out they have diabetes. One thing I need to also mention, some of these patients uh, have symptoms that they don't realize. So extra urination, getting extra sweatiness, getting extra hungry, and that could be that they are not normal to your body. It could be a sign of diabetes. Also, sweating at night, or getting a blurry vision or dizzy. It could be signs of hypoglycemia, which is a low blood sugar levels, usually characterized by having blood sugar levels less than 70, so 50s, 60s. So some of these patients, get those symptoms. If you're a diabetic and you get those symptoms, and that could be a sign of either your blood sugar medications are too much for you, that reduces your blood sugar levels, or your insulin levels are that you're taking is too much for you and causes these symptoms, especially at night. So diabetes is the eighth leading cause of death in the United States. Type 2 diabetes accounts for 90 to 95% of all diagnosed cases of diabetes, and type 1 diabetes accounts for about 5 to 10%. So again, you see way more patients with type 2 diabetes versus type 1 diabetic patients. Type 1 diabetic patients usually are on insulin to begin with, or also insulin pumps. Type 2 diabetic patients, they still have a pancreas function left, so they get on oral medications, and then if the oral medications don't work, then they also get insulin with or without oral medications, depending on their A1C levels. Diabetes is the number one cause of kidney failure, lower limb amputations, and adult blindness. So, those patients with diabetes that are uncontrolled, they experience kidney failure. And diabetes usually damages the small vessels in the body. This includes the kidneys and eyes. And some of these patients experience amputations, experience kidney failure, and blindness at some point in their life. At some point in your life, as a diabetic, your body stops reproducing the small blood vessels in these specific organs, and that's how you experience the complications from diabetes. Some of the oral medications for diabetes may include metformin, SGLT2s, TZDs, and other medications such as I mentioned, SGLT2s or GLP-1 medications. Usually, patients start with oral medications, and then they move to the combination medications of oral medications, and then they move to insulin. Insulins, we may have rapid acting insulins such as I'm sorry, rapid acting, long acting, and mixed insulins. Rapid acting insulins include names such as Lispro, Admelog, Aspart, Lulicin. Long acting insulins, Levemir, Detamir, Lantus, Glargine, Toujeo, or Tresiba. GLP-1 agonists include exenatide, Byetta, Bydureon, liraglutide, Victoza, Saxenda, dulaglutide or Trulicity, semaglutide or Ozempic, Rybelsus, albiglutide or Tanzium, tirzepatide or Mounjaro or Zepbound, which now you know from the market, and that is used also for weight loss. insulin and GLP-1 agonists. We also have combination of those, such as Solica or insulin glargine lexazenatide, and Zultofi, which is degludec and liraglutide. Then we have the CGM devices that go on behind of your arm, and they with a reader, and they can read your blood sugar levels up to I believe about 300 times a day. So instead of poking your fingers for blood sugar levels, you can use CGM devices such as Dexcom G6, G7, Freestyle Libre 2 Plus, 3 Plus, 14-day, and obviously if your insurance doesn't cover the CGM devices, and you can use the blood sugar meters, which comes with test strips, lancets, lancing device for poking your finger, and also test strips to put the blood sugar levels on there, and then use the meter to test the blood sugar levels in the body per day. Lastly, some of these patients get an insulin pump, which gives you small amounts of insulin throughout the day, every 1 hour. And depending on what you eat, when you eat, you can program these pumps to give you more insulin. And then obviously you can program them at night to make sure when you don't eat, to give you less insulin. So this is basically a summary information about diabetes. If you have any questions about any of this material that I shared with you, make sure to comment on the video, and I'll be happy to answer any of your questions you may have more extensively, whether in the comments or through another video about this material. Hope you enjoyed this video. As always, stay safe and take your medications.